Scene 1, the waiting room. I'm looking for Theodore. And could you confirm your last name, please? And your date of birth. Okay, great. Well, my name is Evan. I'm going to be your student technologist today, part of the team that'll be helping to take care of you. If you'll come with me, we're going to take you to the screening room, where I'm going to ask you some questions and explain to you what you're going to have done. Sound good? All right, come on over this way then. And scene 2, the screening room. All right, Ted. Well, it's good to meet you. What brings you in today? Okay, how long have the headaches and tinnitus been going on? Do you know, can you recall if anything happened around the time of either one? Ooh, yeah, a loud gunshot right by your head. Oh, yeah, ouch, I'm sorry to hear that. Um, well, I do see here that you filled out that you have had some surgeries. Could you explain that, please? Yes, the buckshot. Yes, I did check before you came in. I checked your record, and I saw that after the surgery to remove the buckshot fragments, that they had performed several x-rays to confirm that all the shrapnel had in fact been removed, and they all came back, all showing that nothing was left. So they got all of them, so that is excellent. That'll make this a lot easier for you and for us. Now, you said that was your first surgery. Did you have another one? You had your leg amputated. Which one? Oh, this one right here. Okay. So you... Oh, it was a hunting accident? Oh, but I should see the other guy. Well, okay, so the lastly what we're going to do before we get you in there is I just have to go over the check boxes that you've checked off on the screening form earlier. So I'm just going to go over each one, and you just tell me whether it applies or not. We just want to make sure we're getting them all super duper correct and straight, okay? Alrighty. So first off, aneurysm clip. No. Okay, so cardiac pacemaker, implanted cardioverter defibrillator. Try saying that quickly. No on all that. Okay. Electronic implant or device. Magnetically activated implant or device. Nope, nope. Okay. Neurostimulation system. Spinal cord stimulator. Internal electrode wire. Still no on all those. Bone growth, bone fusion stimulator. Nope. Cochlear, otologic, or other ear implant. Nope. Insulin or other infusion pump. Implanted drug infusion device. No for any of that. Okay. Any type of prosthesis. Nope. Okay. Well, not. We'll get to that in a sec. Actually, that's not what this. Yeah. Heart valve prosthesis. Nope. Eye spring or wire. Still no. Artificial or prosthetic limb. Okay, so that's a yes, as we discussed already. So here's the thing with that. We will not, you will have to remove that before the exam, and preferably even before we even get you close to the table. Now, if we were to give you, say, an MR safe cane, and or if we assisted you, do you think you would be able to make your way into the table? You do. Okay, you don't think that would be, okay, great. Okay, if that changes, obviously just let us know, and we'll figure something out. Okay, so where was I? Yes, metallic stent, filter, or coil. Nope. Shunt, either spinal or intraventricular. Another tricky one to say. See, at least you don't have to say this stuff. You just say yes or no. I just pronounce it all. Vascular access port and or catheter. Nope. Great. Radiation seeds or implants. Nope. Swans, GANs, or thermodilution catheter. medication patch, like for nicotine, nope, okay. Any metallic fragment or foreign body, so we know because we checked, like we checked and that was all thankfully removed, so that's awesome for us. Wire mesh implant, nope, great. Tissue expander, nope. Surgical staples, clips or metallic sutures, nope, we're good with that. Joint replacement, hip knee, nope, okay. Bone or joint pin, screw, nail, wire, plate, etc. And you have none of those. Okay, great. There we go. UED, diaphragm, or pessary, I know they don't apply, but it's on the list, so I have to ask. Dentures or partial plates, nope. Tattoo or permanent makeup, nope. Body piercing jewelry, nope. Hearing aid, nope. Other implants, nope, we're good on that. Breathing problem, motion disorder, nope, nothing with that. And claustrophobia. That's true. I guess if you're used to hibernating in caves, that probably wouldn't be an issue for you. Alrighty, okay. So actually, considering what you've been through, that's actually pretty good. So you're actually in pretty good shape. So this should not be much of a problem for you at all. So here's where we're at. So you're here for an MRI. As you have you ever had an MRI before? No. Okay. So here's what to expect. It'll take about 45 minutes. What we're going to do is we're going to bring you into the table and lie you down on it. We are going to put your head into what we call a coil. It's just an imaging device that we will use to get all the scans and images that we need, that the doctor is ordering. The room, most people find it cold. So if you find it cold, we'll give you any blankets you need to keep you nice and warm and comfy, and anything else you need for that matter to keep you nice and comfy. When you're all set and comfy, we will then go ahead and slide you on in to the magnet. The magnet is going to be loud, so we always give our patients earplugs. Now, especially in your case because of tinnitus, I think what I'm going to do is after the first scan I do, I'm going to talk to you. We have a communication system, which actually I'm going to get to in a second. I'm going to talk to you, just ask you how that was, and just make sure that it's not too loud, and if it is, we'll take some extra precautions. Speaking of communication, like I said, we are going to give you a communication ball, so you can squeeze that anytime you need to have any questions, concerns. We'll pause the exam, and you can ask us your question, and then we'll go from there. And then we'll just do that until the exam's done. Makes sense? Do you have any questions about it so far? No? Great. Okay, so just last thing, before we bring you on in there, we are going to need to have you change into an examination gown. We have changing rooms that we will have you do that in. Now, if you were wearing clothes, we would have to have you remove everything from the waist up. From the waist down, you would be able to keep on your underwear and socks, but we don't have to worry about any of that now, do we? Any of your belongings, we are going to put in a locker over there. When you're done with the exam, you're going to come on in, get them, and that'll be that. When you are done changing, I strongly suggest that you use the restroom. So that'll be one less thing we have to worry about during the exam. Alright, make sense? Alright, that is basically it. Unless you have any other questions, we're ready to go. Anything else for us? Not at the moment? Okay, well, by all means, if you do at any point, you let us know. Alright, so let's go ahead and get you changed, and then we're going to go ahead and get this started. Alright. And scene.